Zambia is a resource-rich Southern African country that has seen significant economic growth in recent years. But it is also one of the countries most affected by HIV. The pandemic is the single greatest threat to Zambia's health and future development. Compounding the crisis are social challenges such as unemployment, gender inequality, and a high youth population. Of the country's 12.2 million people, 1 million are HIV positive. Nearly 2/3 of Zambians live below the poverty line. In response, the UK Department for International Development funded the Strengthening the AIDS Response in Zambia program, called STARZ, from 2004 until 2009. The program concentrated support on the newly formed National AIDS Council, known as the NAC. STAR's vision was to strengthen a nationally coordinated HIV response. £20 million of funding has supported the response in every sector: public, private, and civil society.
We've seen improvement in the care of people living with HIV and AIDS, and also increase in the number of people accessing antiretroviral therapy.
Over the past 5 years, STARZ has translated vision into reality. These are the stories of some of the people who've shaped this reality. HIV is most prevalent in poor urban areas like Mtendere, a high-density slum in Lusaka, Zambia's capital. Unemployed young men have little to do. Young women lack the space to discuss their private issues. Here, STARZ provided a grant to Africa Directions through the Zambian National AIDS Network, known as ZANAN. Women in Zambia are particularly affected by HIV. One of the project's aims is to allow them to talk openly about HIV and their sexuality. It draws girls to the center through social and sports activities.
We've incorporated netball into our program because it's a way that we can reach out to the girls more effectively. Through the netball tournament, we're able to disseminate our information on HIV/AIDS and girls' sexuality.
Playing today is Anita Kamutumwa, an Africa Directions peer educator. Anita's commitment to fighting HIV in Zambia goes far beyond the netball court. This morning, she is preparing to host a girls' group picnic.
HIV has affected me in a way that I lost my father in 2004. My father was a good man, I'd say. But one weakness he had is that he had too many women. In 2004, I went to school to study counselling and HIV, systemic HIV and AIDS counselling. When I came back, I found my father sick. When they tested my father, he was actually found to be HIV positive. He died on the 13th of December. That was 2004. It was not easy for me. I was thinking, I can accept the fact that my father has died of HIV, but has society accepted that? So I said, what positive thing can I do for society just to save at least 1,000 lives, because I couldn't save my father's one life. Yes, guys.
Hi.
How are you guys?
Fine.
How's it going?
Fine.
There are times when, we get to find our boyfriends telling us, if you don't have sex with me, you don't love me.
Africa Directions provides positive recreation for Tendere's youth and gives them direct access to much-needed HIV information. STARZ has worked to boost the capacity of civil society organizations to respond to HIV, especially for marginalized groups like people with disabilities. Through ZANAN, STARZ gave a grant to the Zambia Federation of Disability Organizations, called ZAFOD. The focus is to combine HIV support with sustainable development. David Mukwasa, a ZAFOD project manager, travels to a rural community 150 kilometers from Lusaka. It's a routine visit to the Nadezwe Disabled Cooperative Society.
We started a project there to empower persons with disabilities, especially those with HIV and AIDS.
The cooperative was founded in 2000. It quickly grew to over 150 members. In 2005, a pump was installed, and 2 years later, a windmill. But when the welcome is over, David discovers there's a serious problem.
We have our windmill broken.
Oh.
That now we have planted some seeds, vegetables, potatoes.
Yeah.
All the plants are
Dry.
dry.
Yeah.
Without water, the future of the cooperative is at risk. Many members have left to find work on distant farms. A profitable fish farming project has faltered, and the planned preschool has been put on hold.
This is our windmill.
Uh-huh.
The problem is the upper side has broken.
We are going to have a meeting at the Disability Forum back in Lusaka, and we will present the case to the forum and see how we can help.
David leaves, carrying the community's hopes back to the city. Returning to Lusaka, he attends the quarterly NAC Forum on HIV and AIDS for people with disabilities.
All right. Where do I go? Yeah. A few days ago, I was in Mazabuka with the team, and what we found there broke my heart. Now, since there's no water in the fish pond, so it means there's no fish. There's no garden going on, so which means there's no income.
After discussing Nadezwe's problems, the forum continues its meeting. Its primary role is a strategic one: to share information, build partnerships, and promote advocacy. With the forum's go-ahead, David meets NAC and STARZ representatives to solve the problem.
You really need the person who worked on it to repair it. Otherwise, if we get someone else, might just mess up the whole thing.
As the water flows, Nadezwe's hopes for the future are restored. Half an hour's drive from Nadezwe, another initiative is underway at Kushia Dairy Farm near Mazabuka. It's facilitated by Afya Mzuri, an NGO engaged by STARZ to support HIV workplace programs. Mary Mwemba is coordinating today's on-site voluntary counseling and testing.
We normally do this as an annual event to reduce the challenges of workers going for VCT at the district hospital.
In the past, few people were willing to be tested because of the stigma surrounding HIV.
Workers were worried to say, what if I'm found positive? How will my colleagues look at me? Maybe the managing director is organizing this thing to find a way of terminating our employment.
But 4 years on, worker attendance has risen sharply. Kushia Farm has become a successful example of a sustainable workplace HIV program.
As a result of STARZ project is that it helped Afya Mzuri to extend the services to a lot of workplaces.
Another workplace where Afya Mzuri is active is Lafarge Cement in Chilanga, near Lusaka. The plant employs over 400 people. Sylvester Zulu is a technician and one of the plant's nearly 50 HIV peer educators. Their HIV workplace program has been running since 2000. At the daily HIV health and safety briefing, he teaches fellow workers about the progression of the disease. Free on-site counseling is also provided for employees. Recognizing that HIV doesn't begin and end at the factory gates, the program reaches out to the surrounding community. Community peer educators are trained by Afya Mzuri and funded by the company. This collaboration between company and community is a working example of the STARZ vision, a truly multisectoral response to AIDS. In public, private, and civil society, STARZ has achieved in all sectors.
They brought valuable technical skills into the National AIDS Council. By the end of the program, basically NAC is now self-sufficient.
Almost 350 civil society projects were funded, 176 of them in rural areas. Nearly 600 youths were trained as peer educators. Over 200 people with disabilities received HIV prevention training. Support was given to 40 workplace programs with a proven reduction in HIV infections. By building skills and linking sectors, STARZ has strengthened Zambians' ability to work together against HIV.
Tata mukomano, chigoro da pasa.